Good morning to everyone. It's my honor and pleasure to present Progression as Cardiac Technologist in Cardiaco 2K23. I request everyone to close your notebooks. Uh, the copy of these slides will be mailed to you. So just pay attention to the talk, please. So every one of us will have a question that what I'm going to do after BSc Cardiac Technology. The same question I had during my student days. So I think I found the answer. With my limited knowledge and source, I try to put up this slide. I hope it will be useful to you people. So after BSc Cardiac Technology, the career can start by three ways. One is academic. After BSc, you can do MSc. By the way, you can become lecturer. And after MSc, you can pursue your PhD. By the way, you can become professor, or you can get job in industry as a research consultant, or you can be a part in research and development team. So in terms of profession, you can be employed both in hospital as well as in industry. If it is a hospital, you will be employed as cardiac technologist, sorry. And after a couple of years experience, obviously you can pursue your MSc, or you can search for abroad opportunities with some certification exams. Or you can become lead cardiac technologist in the same hospital, or you can search for government jobs, or you can freelance. So this freelance is kind of part-time job. So some of my friends and colleagues are working as an echo technologist. They'll be working only in the evening clinic or morning clinic. And some of them who are doing full-time study will work as a cardiac cath lab technologist by just doing or attending primary cases at night. And while you're working as cardiac technologist, you can also do your postgraduate course in alternative medicine or psychology. This is a distance education. So that you can have a two career as a cardiac technologist. On the other hand, by your postgraduate course, you can have a other career, for example, say yoga therapist. On the other hand, if you joined in the industry, you'll be employed as an application specialist. At any time, you can switch back. If you are in the industry, you can switch to hospital. If you are in the hospital, you can switch back to industry. So it's vice versa. After application specialist, you can be promoted to a manager level, or you can get into marketing role if you are interested. So every role has a merits and demerits of its own. One has to pay close attention and choose it wisely according to its individual character, personality, and interest. So when it comes to interest, you should know what interests you. So how do you know? For that, first you have to explore the things. So the student time is the only time for exploring everything, like echo, ECG, cath lab, EP, pacing, research, everything. By that way, you will know what suits you, what interests you, so that you can decide your career according to that. And obviously consider family situation, economic factor, and physical conditions. I hope this slide is useful to you, because it took so much effort for me to put up or compile this in this way. My progression as cardiac technologist, I was sitting there in Cardiaco 2K18 as a student, like you people. And now I'm working as chief cardiac physiologist in Cambridge University Hospital. So what are the benefits of this profession? So I feel the utmost benefits of this profession is satisfaction. So you don't have to spend separate time for serving the mankind. You're serving the mankind by your profession in day-to-day life. So that satisfaction will make you happy in one way, apart from salary, obviously. And the other thing is, it's not the profession just working in front of the computer all the time. You are meeting various types of or various kinds of people in day-to-day life. So I feel that's one of the benefit. And you are a part of team. So you will know how the hospital functions, or you will have a awareness about a healthcare system. So by the way, your relatives or your surroundings will get benefit through that. And one more important thing is, so in cardiology, it's all a teamwork. So each one of the team member has its own roles and responsibilities. As a cardiac technologist, we are the one who are going to report the findings and help the consultant in making diagnosis. So the treatment depends on your report. So realize that read for patients, not for marks. So if you give wrong report, that obviously going to affect the patient treatment. So please be mindful. And we are the one helping diagnosing disease, and consultants are the one who are going to decide treatment, and nurse are the one who are going to deliver the care. It's all teamwork. I feel the cardiac technology should have a certain characters for their profession. One is patient. So you should be patients even in emergency situation so that you can think clearly and act correctly. Sometimes patients can urge you to make report that can lead to wrong assessment. So be patient always. And observation. Observe the patient. Always correlate your findings with the patient's symptoms and their associated disease conditions. Some of them may have a kidney failure disease or liver disease. So associate your findings with all the things related with the patients. And then stay focused. So some of the time, when we are watching the monitor, cardiac monitor for a long time, we may feel bit, for some time we may feel slipped away for a while. So stay focused. If you are not focused, you may miss minimal or sometimes major findings like LV thrombus, left atrial appendage clot, or even you can miss damping during canalization of the catheter. And have relative and reflective thinking. Reflective thinking is nothing but just applying theory part into the practical part. Relative thinking is correlating physiology and pathology, correlating pathology and pharmacology, or correlating your findings with the patient's symptoms. Accept the faults when you did it, so that you will be more conscious and you will not make mistakes more often. And during the course, you have to develop more skills, and this is the only time to equip yourself. So get strong in your theory, develop practical skills, perform echo, just try to do some views, get excel in the ECG interpretation. When you go for a job in the interview, they will ask for your practical skills. They will assess your practical skills. They'll not look for your marks. Mind that. And get BLS or ILS course certificate. Develop your academic writing, presentation skills, and leadership skills. These are some of the certification courses which would be helpful if you are trying for abroad jobs. And each one has got their website, so look upon that. These are some of the topics which are unexplored parts of cardiology by us. So when I looked at first, it grabbed my interest. I hope some of them will be attracted by these topics if you are interested in kind of research activities. And These are list of postgraduate and doctorate courses available both in India as well as in UK. You can have a read through when you got the slides. Thanks for listening. If you have any doubt or comments, any suggestions, please mail me in the given mail ID. Thank you again.